Hi everyone, welcome back to the hashtag #CArthritis event here at Arthritis Broadcast Network. I'm so happy. We've stolen this man from the middle of what he was doing at the meeting here. And before the great debate takes place, it's really wonderful to have Admad Zbib with us this afternoon. He is the new CEO of the Canadian Rheumatology Association, and of course we're here at the annual meeting. And so we're very grateful that you've taken time to sit with us for a few minutes. Ahmad, thank you very, very much.
Oh, our pleasure, and thank you for being here, because that's just a testament to, the way our organizations work together, with patients who are, why we exist, basically.
Exactly. Tell me, so that our viewers can hear, kind of straight from the horse's mouth, what is this meeting all about? Why do annual meetings of professional associations, medical associations like this, why do they take place?
So, I can definitely speak about the CRAs,
yes.
And I know why we do that, and it's because there are multiple reasons. It's, optimal care is top of mind for us, and one of the ways to deliver optimal care is to ensure that our members have the best education and skills to deliver on that. So there's an educational component to it. The second thing that is extremely important and that our members constantly voice is connections. And they want to establish those connections, the connections that will help create the next research project, the connections that will help start the next center of excellence, the connections with outside the rheumatology community, with the healthcare providers, allied healthcare providers, connections with the patients, all of these, it's what really our members care about, and that's what our ASM is all about.
Yeah, we like to think of the CRA as a membership full of heroes, that actually patients who have arthritis, no matter the type of arthritis, when you look through social media, Ahmad, and you look at the things that are said about rheumatologists, they really, and I'm speaking from a personal perspective here as well, as a person with rheumatoid arthritis, we view your membership as not only collective heroes, but individual heroes. And we've had the blessing of having a number of them already come through the broadcast booth and share the same science they're sharing with each other at the meeting with our Facebook and Twitter.
Right.
So kudos to the association for and all of the team that you work with and lead to make this meeting happen, because it is very important to us for the reasons that you state, but also for the hero worship that we have as well out in our community. When you look at this particular year, 2018, we've been talking to everyone that's been coming through the booth about the topic of precision medicine.
Right.
And I guess from sort of an association perspective, why that topic? Why is that important to talk about now, do you think?
We've gone through an evolution with medicine. It used to be an art and a science, to evidence-based, to quality improvement, to now precision medicine. So there's been absolutely an evolution, and I think the only way to really serve our members and the people they serve is by making sure that we look at the patient, not as a case or as a disease. And that's when precision medicine is going to come very handy, because there's new tools on a daily basis coming out. There's new science and evidence that can augment the knowledge and power of a rheumatologist. And this meeting is so important because it's through these venues that we can actually inform our members that this is possible.
Right.
And it's also connecting with the patients, and not that they need any reminders that patients exist, because they see them on an everyday basis.
Yeah.
And it's, it also what matters to the members. It's I was meeting in a different capacity with one of the rheumatologists at one point, and she was in tears describing one of the patients, and it really moved me, and it was actually an amazing moment when I realized I was coming into the rheumatology community, because I wanted to be part of this community who cares.
Yeah.
And so that's precision medicine is where we're heading. Actually, in many cases, we're there already.
Yeah.
So it is important that we continuously push ourselves. There's a limit to how many books you can read in a month or how many papers you can read in a day. So it's through these connections and through these discussions that you can continue to learn.
Yeah, I think I really liked what you said about the patient as a person. And I know that Don Richards, who's a Canadian Arthritis Patient Alliance member, just had an opinion piece published in the British Medical Journal that talks about that very thing, that I am more than just the disease. So I'm glad that you highlighted that as well in your remarks. And I know that the rheumatologists certainly that we interact with every day in the work that we do to provide education information, they're people too. And they do carry a huge burden on their shoulders. It's interesting, your membership, probably as a specialty, physician specialists, spend more time with their patients than almost any other specialty.
It's true.
It's unbelievable.
It's a longitudinal relationship. It's not a transaction.
It's a lifetime disease,
right.
and I couldn't have phrased that any better. It's not about It's not a transactional
right.
kind of relationship.
Right.
It is one where we were talking to Dr. Amiri this morning about pregnancy and rheumatic disease, and then seeing children born of patients that you've been treating
right.
so carefully because of the state of pregnancy and the great care you have to take. So it always strikes me how dedicated the Canadian Rheumatology Association membership is to providing that quality care,
right.
for you, making the venue available, the environment to share information and science is really fantastic. I hope this question isn't putting you on the spot, because I know you're...
I'll let you know if you are.
Okay, thank you. I know you're relatively new to your position, and it's so great to have you in the community. I know that you came from another arthritis organization, so a group that we work with obviously closely, the Arthritis Society. But when you, in your new capacity, you think about the profession, what do you see as some of the challenges, obviously, and for your profession, and what do you see as some of the opportunities?
Yeah, I mean, the challenge is the disease management care is getting more and more complex because of the need for precision. So there's going to be a lot of pressure on our members to keep up with the science, but at the same time, technology is coming along, and we're looking at artificial intelligence and virtual reality, and all of that will actually augment the capacity of, at least that's my prediction, of the rheumatologist to be able to provide better care, augmented with some strong decision making, and make it less so about the art and more so about the science.
I see.
While not forgetting that this is a human, this is not a disease. Yeah,
I mean, the joint count remains, that physical exam remains probably the best screening tool,
right.
And it has nothing to do with technology. It is the art of the physical exam,
right.
for so many people in their journey to find out what's happening with their body.
Right.
And I don't think that skill will ever be lost, and
No,
I think there is a science behind it as well.
Absolutely.
Yeah. So challenges is, how do you integrate all that stuff?
Well, that's one.
And there's a
component,
cost,
right?
obviously, that comes with these kinds of things.
There's that, and also making sure that we're keeping up with time and keeping up with the population growth. And there are a lot of pressures on our rheumatologists to you look at some of the practices of the older rheumatologists working 80, 90 hours, no life balance. It interferes with their home, and so we wouldn't want that for the younger rheumatologists, because things are changing, and yes, the parents should spend more time with their kids. So all of that into consideration we need to look at, and we need to understand what are other forces and what other key players that we should take into consideration and observe, and also how do we leverage our partnerships? How do we should we ask for more rheumatology spots in Canada?
Yes.
Our population is exploding, right? And it's a great thing for Canada, because Canada needs more people.
Yeah.
But at the same time, it will put pressure on rheumatology.
Yeah, that's a really interesting point you bring up about that ability to see so many patients in a day. I think from a rheumatology patient perspective myself, I mean, I don't want to feel like I'm being flown through a factory. And I don't want to lose that opportunity when I'm only there maybe twice a year,
Right.
3 times a year. I don't want to lose that time, precious time that I've had with my rheumatologist. But growing capacity is a big issue for not just rheumatology. It is for other specialty healthcare providers. And I know the CRA has been running a campaign to increase or attract people into the field. Can you tell us just a little bit about that?
For sure, yeah. I think it's been happening for a while, and now we're actually reached a point where, because at some point we had rheumatology spots across the country not being filled because residents were not applying for rheumatology. And I think the CRA has done an amazing job, and I can't take any credit because they just started, and all these positions are being filled, and not just being filled, they're being filled with some of the top-notch students in the country. So the CRA has done an amazing job to create a pipeline and fill these positions. The problem is that perhaps, and again, I'm new, so I might be making assumptions, maybe we don't have enough physicians.
Right.
So that's one angle to look at. There's looking at the models of care. There's many ways to look at it. I think that's going to be extremely important for us to keep in mind.
How many rheumatologists are there that are active practicing, let's say at least 3 days? Because some of them only treat and see patients 1 day a week because they're doing it as part of a research. Their research. Right. But when you think about your membership, no exact number is needed. How many of your members are actually seeing patients full time?
Yeah, I can't speak to that, and it's probably because I'm still new and I haven't maybe reached that report that we have.
Yeah.
I know that the number is not necessarily very clear entirely. I know there are some surveys that we've done, but I think there's more work to be done in terms of quantifying, because not everybody who's practicing rheumatology necessarily is a member of the CRA. We do have a lot of them, but there are some that we're not aware of.
So there's about 400 rheumatologists per.
I think that's the common number.
Yeah.
I think there may be a bit more, but not all of them are practicing or academic or retired. I'd hate to put a number on it.
Yeah. But I guess why I'm kind of groping around that number is to really illustrate for our viewership that there's 5.6 million, somewhere between there and 6 million people living with a musculoskeletal disease, and that's not enough.
No, absolutely not. I mean, that assuming that the 6 million that are old. I mean, there's a lot of OA, which usually doesn't fall with
into
few
the
exceptions into the rheumatology. Yeah. But there's still a significant number, and again, you talked about this. It's a relationship that the rheumatologists want to spend time. Actually, it's interesting that the people, and I was talking to some of the students, and it's like, what I'm thinking about, and why are you getting interested? Because they don't know if they're going to get into rheumatology or not. And what they're saying is, I love the first, the mentor was amazing and inspired me. Again, the hero thing. But they love that aspect of relationship with the patient. Yeah. So this is what's drawing them into the profession.
So it's like a people healthcare provider profession.
Yeah.
If you love people and you want to spend that kind of time with your patient, then rheumatology is your gig.
Right.
Yeah. Very cool. We know you have to run off and fulfill your duties as CEO of the Canadian Rheumatology Association. We're so grateful that you came by to chat with us, Ahmad. We congratulate you again on your position, and we very much look forward to partnering and continuing the Arthritis broadcast booth in the future. Just have a great meeting, and thank you again.
Thank you.
Yeah.